I would like to show you now the edema treatment for the leg. The lymph drainage, a very simple treatment, effective to take off liquid from the tissue. Before starting the procedure, make sure how the skin conditions are. There should be no open wounds, ulcers or infection, rashes on the skin. Just check the skin on all its parts if skin is okay. If you find infection, open wounds or parasites on the skin, it will be a contraindication to this treatment. Then you should check if the underwear is not too tight. If the elastic of the panties is very strong, the liquid won't pass through, as the pressure in the lymph veins, in the lymph vessels, is very low, and a strong elastic will block it. So it should be like here. It shouldn't be really a straight elastic band. Now we can start. First activity is we teach the patient abdominal breathing. You put your hands on the belly, maybe your little finger comes here to the groin, and breathe in and out deeply, without hurry, so that you can feel the belly becomes big and small. Abdominal breathing is stimulating a sucking process, so it helps to suck the liquid from the leg towards the belly. So it's increasing the lymph drainage. This is an exercise patient can do whenever they like. They can do deep breathing exercise to activate and increase lymph drainage. After the patient has done that, we can start. I'm doing here in the groin, I put my hand and I'm circling, activating the lymph nodes. And as you can see, I'm moving the tissue with my hand. I'm not slipping with my hand on the skin. I'm moving the skin. So I'm stretching, it's somehow a sucking process, and I let go. So that I do here in the groin, activating the lymph nodes. Slowly, without a lot of pressure. And my patient can go on breathing deeply. You can see the work is slowly. Don't hurry. Having done that for 2-3 minutes, we can start to work on the leg. With my hand I do these circles. You see again, I'm not moving on top of the skin. I'm moving the skin with the subcutaneous tissue and the connective tissue which is below. And my hands, when I go up, they push a little bit like this. And I do this big circle. So I'm pulling the tissue, I let it go. I'm pulling the tissue, I let it go. Like this, the lymph vessels will be activated. Having done that here, I just go one hand below here. And I'm doing the same. Now liquid from this part is shifting up here. Up here I already shifted it towards the groin. Don't push too strong. It's not like classic medical massage where you really work with the tissue and you go into it. No, it seems very sufficient, very superficial, without hurry, without a lot of pressure, but pull the tissue. Having done it here, I go one hand below, and I do it above the knee. Having it done here, we will do it on the inner side of the abdomen. We start again up here. Near to the groin, you move the tissue, still circling and moving the liquid towards the groin. And so on. I will do it here, and then I will do it here. And I can do the same on the outside. I'm starting here, and then bringing it to this direction here. I do it here. And I will do it here too. I can change the position now. I can place myself here, and then I do it like this.
Chiudo la tendina.
Now we are left with the back. Very often on the back of the thigh we will find a lot of liquid. So I show it that we can see it. I start up here near to the buttock, and I do these circling movements, and I shift it towards the buttock. So the leg will be placed like this, and I'm working here now on the back of the thigh. If I show you, I just do like this. The same in the middle part, and the same on the lower part. You can use for this part here as well this position. And I'm squeezing a little bit. For all these parts on the thigh, here, inner side, the outside back, you can do this type of intervention. You hold it, you somehow grasp it, and then, yeah, you bring it up. Let go. Hold it, you bring it up. Hold it, you bring it up. Hold it, bring it up. Hold, up. And on the back, you hold, up. Hold, up. As well, we can do very soft strokes. This is a technique which we seldom use. We still can do it. For lymph drainage we are not using oil or powder. We just do it on the skin. So let's finish part 1 of this video, and in part 2 you will see the treatment of the lower limb.